If you are even kind of remotely thinking about insulin resistance, and given the fact that 1 out of 3 Americans has pre-diabetes, then you probably should be thinking about it, then you should consider going for a 15-minute walk after every meal. Insulin's main job in the body is to take sugar from the bloodstream and put it into the cells that need it. And if you are insulin resistant, that means that it takes a lot of insulin to take that sugar from the blood and put it into the cell. And that means that more sugar is left in the bloodstream, and that can cause some major problems. After we eat, and more specifically after we eat simple carbs and starches, then we have a spike in our blood sugar. Over time, this can lead to insulin resistance and major fluctuations in our blood sugar, which is not what we want. And a really simple and easy way to overcome those blood sugar spikes and fluctuations and normalize blood sugar is to simply increase the cellular need for sugar. Because when our cells actually need sugar, the body is triggered to use insulin more efficiently. So that insulin will take an armful of sugar from the blood and put it into the cell. That gives the cell the energy that it needs, and it removes the sugar from the bloodstream where it can potentially cause damage. And the best way to increase cellular need for energy is to exercise. But it turns out that you don't have to be hitting the CrossFit gym or running a marathon to increase that cellular need for energy. It can be something as simple as taking a 15-minute brisk walk after a meal. So you have a meal and your blood sugar starts to increase, but right as it starts to increase, you go for a brisk walk, slightly increase that cellular need, and that sugar is immediately put into those cells and it normalizes that blood sugar level. Diabetes and prediabetes is a gigantic problem worldwide, and particularly here in America. If everyone went for a brisk 15-minute walk after every meal, our issue with diabetes and prediabetes would definitely decrease significantly.